Antonio, who's Vice President of Policy and Professional Affairs at the Gerontological Society of America, and also Program Director of the Reframing Aging Initiative, and Lori Lindberg, Program Manager of the Reframing Aging Initiative. We're really pleased to have you both here today, and take it away.
Well, Megan, thank you so much. If we want to go to the next slide, we want to talk a little bit. We could go forward one more. A little bit about the Reframing Aging Initiative, which is a long-term social change endeavor designed to improve the public's understanding of aging. And it's a research-based program, which I think we're pretty proud of because, and it's a long, and the communication strategies, you can go back to any of your colleagues and talk to them about why we recommend the way we do and have some evidence to support that. So in our next slide, I just wanted to go a little bit over our objectives for today. It's to familiarize you with the Reframing Aging Initiative, why there is a movement to reframe aging, understand why it's critical because of the prevalence and the impact of ageism across our lives, as well as describe some of the concepts that form our basis for research around cultural models and the public understanding of aging, which we call the swamp of public understanding. And then define ways that you can start to reframe aging. So I am not going to pretend that after an hour, you are going to have all the answers. What I am going to suggest to you, though, is you can start with small steps at this point. So if we go to the next slide, I just want to tell you a little bit about the Gerontological Society of America, where the initiative is housed on behalf of the leaders of aging organizations. We are a professional membership association. We are multidisciplinary in our membership. The common theme across all of our members is that they work, study, or teach in aging. So aging across the lifespan. Our members, we like to say that our members are from A to Z in aging. So we have anthropologists to zoologists. People are studying the biology of aging, health sciences, social sciences, so psychologists and sociologists, and then those that are working in applied research. Ultimately, we are all looking for that interdisciplinary environment that optimizes health and well-being in an aging society. So we go to the next slide. I just want you to take a second and think about ageism yourself. So have you experienced it? Have you seen it? Can you identify a time when you have been ageist? I'm not going to ask you to chat that answer in, but I just want you to think about that. What does that mean when we talk about ageism? And here's one place where I think is a great example of where we see ageism. If we go to the next slide, we see ageism quite often, and we don't think anything of sending a birthday card that makes fun of someone's age. So let me just give you a couple examples here. What could be more fun than getting older? Let's go to the next, just click it. Almost anything, actually. Happy birthday. Now, how does that make you feel? Let's go to the next card. At our age, swimming is dangerous. Let's go to the punchline. The lifeguards, they don't try as hard. Happy birthday. Next one. Don't be upset about turning 60. Lots of people are 60. Why, if you were to take all the 60-year-olds in the world and lay them end to end, let's go to the next part. Very few of them will be able to get back up under their own power. Happy birthday anyway. So we could go through these other cards quickly. There's two more cards on here. I know you've seen these ladies on cards. Where are we headed? I don't know. I thought you were driving. And the last card takes us through decades of aging. And if we go to the next slide, right? At 50, I forget what I want. So I just want to say that, remember, this seems to be just accepted in society that we make fun of people's age. Let's go to the next slide. And there's some research that bears this out from our colleagues at the University of Michigan who conducted a study. I'm not sure if you've seen this. If you haven't, it's a short paper to take a look at. But when they interviewed people ages 50 through 80, We found that 82% of the respondents experienced one or more forms of ageism every day. And if you look here, there's ageist messages that people have seen, the interpersonal interactions, but also internalized ageism. And I think we really need to think about that. We internalize ageism ourselves. So let's go to the next slide. I want to make sure that we're all talking about the same thing when I say ageism. So we're talking about discrimination against any persons because of their certain age group. Our project is especially focused towards older people, older adults, but let's not forget that there's ageism towards younger people too. And how many of us have heard somebody just throw around, "You're such a millennial," right? So those kinds of terms, that's really something that we need to think about, because we tend to start to think that people are unworthy in some way. And in particularly with older adults, we start to think of all older adults. If I were standing in a room presenting before you, you'd see me start to hunch over, right? As you age, everybody's debilitated, everybody's got a wheelchair, everybody's got a cane, and no one's suitable for employment, right? There are implicit biases that we have grown up with, and Lori's going to talk a little bit more about this. They're the thoughts and the feelings and the behaviors that make us think about older people in a certain way. So go back to the video, think about the video that we showed and what you heard in the befores, right? The before interviews. And you heard people saying, you actually, it wasn't even just what they were saying. You actually saw it in their faces, right? Everybody made this kind of crunchy face look that made you say, "Ooh, aging is gross. I don't want to do that." When actually we're all aging every day, right? And when you think about this, there's the ageism that's perpetuated by others, but there's the ageism that we impose upon ourselves. And we really have to think about that as we're moving forward in any of our projects. So let's go to the next slide. There are significant impacts of ageism on health that we know. And some research has showed us that some people, when they have negative attitudes about health, about aging, it's a chronic stressor. And we know that chronic stressors are not good for us as we age. They're not good for us at any time. When you have a low self-perception or a negative attitude toward aging, there's predictions for cognitive impairment that we can make. And there's research that shows that. We've seen Alzheimer's disease biomarkers, what happens there, the development of those biomarkers. And the one thing that I think is most important, and Becca Levy out of Yale has done some great research on this, 1 in every $7 spent in healthcare can be attributed to ageism. So if we go to the next slide, sometimes we think, "Oh, I have a pain. It must be because I'm getting older." Or you go to a healthcare practitioner and you say, I'm in pain. And they go, "Oh, that's some of that back pain that you get when you get older." Well, I'm a pharmacist by training. I'm board certified in geriatrics. I can tell you, and you all know working in public health, you could be in pain. You are getting older. That is not necessarily the reason why you're in pain, right? So we should be checking that out. But if we delay that care, what's the impact there for us? The other piece too is not just in healthcare, but in age discrimination. 1 in 3 in 5 workers have experienced some form of age discrimination, whether that's they can't get hired for a job, they can't get promoted, or they're asked to leave. And, we say to ourselves, well, that can't happen. We have age discrimination laws. Well, it happens. And our colleagues at AARP have done significant work on that to show us how they can show how that happens. Let's go to the next slide. I don't want you to feel like this is all, we invited this woman to come and talk to us about doom and gloom about aging. I'm not here to talk about that. I'm here to tell you that there are ways to start to think about aging that can improve the public's perception of aging. Some of the good news is when you have a positive self-perception of aging, your health span increases by 7.5 years. The other piece is, and this I find really fascinating if you really want to dig into the research, with Alzheimer's disease. So people who show biomarkers for Alzheimer's, if you carry a positive attitude about aging, you are 50% less likely to develop Alzheimer's, even though you have the biomarkers for developing Alzheimer's. Now think about that. Let's go to the next slide. And some of that bears out in what our colleagues at the University of Michigan found when they did their study, right? If you think about age as a destination rather than, age as a process, when people were asked, they had much more positive views about aging than they thought they would, right? And if you see the 65% of those interviewed think their life is better than they thought it would have been. So if you don't get it, if you haven't had a chance, I really would say take a look at this, especially as you're starting your journey in the age-friendly public health arena. There's more good news. So I showed you, we go to the next slide. I showed you that video at the beginning, and we talked about how that video talks about implicit bias. So we interviewed people and we said, what do you think about aging? We read them a statement that said, that primed them based on the research that we know and how to frame messages in aging. And then we asked them the same exact question again. And this all happened within a short period of time. I mean, they didn't walk away and come back, right? And you heard how their answers changed. Well, there's research that shows that short-term framing interventions, where you make someone aware of their implicit bias, can start to get them to change their mind about aging. And then there's also some research that's been published in the American Journal of Public Health that shows us the same. So let's go to the next slide. This is where we come to the Reframing Aging Initiative. Again, long-term social change initiative. So it's about communication strategies and how you can talk to people about aging, how you can write about aging that makes people start to think differently and have that perspective on aging that is more positive. So let's go to the next slide. I mentioned earlier the leaders of aging organizations, these executive directors got together years ago and said, what is causing us to have a problem with advancing our initiatives, advancing our policies? And the one issue that came up resoundingly was ageism. So if we go to the next slide, they started to talk about how can we address this? What can we do? We're pleased to say that 4 funders came together nationally to help us move this project forward, including the John A. Harford Foundation, RRF Foundation for Aging, the SCAN Foundation, and the Archstone Foundation. If we go to the next slide, and we started to work with other people locally and regionally. So there are foundations that have helped us locally to work in this community. So if any of you are familiar, there's some projects in the Northeast, in New Hampshire, Massachusetts, Connecticut. There's a project in Changing the Narrative in Colorado, and Successfully Aging and Living in San Antonio, which is otherwise known as SALSA. So love that name, how they came up with that. Let's go to the next slide. And we work with our research partner, the Frameworks Institute. So we contracted with them. They're a think tank whose mission is to advance the nonprofit sector's issues on reframing social issues. So we worked with them to develop the Reframing Aging Initiative. If we go to the next slide. So what does it take to frame an issue, right? So first, we worked with Frameworks and they mapped the terrain. They went out and they did interviews. What does the public think? What do experts think about aging? Then try to develop the strategy to get us all to move to higher ground about aging. And then, like we are here today, we're building a caravan, we're equipping the travelers, and we want to move to get the public to think differently about aging. Let's go to the next slide. And so no matter where you see yourself in these cogs, and you might not see, so some of this is around my ability to get all this to fit on a slide, but we all have a way that we are situated in working in age-related services, that the Reframing Aging Initiative is working to get everybody to have the same hymnal, but maybe we're singing different songs, right? And with doing that, wherever you see yourself in this and how you're working with aging, as you start to adopt these principles, if we go to the next slide, you can start to see that we can get the discourse to start changing. People's conversations will change about aging, which will start to get their thinking differently, which we know through our work with Frameworks will get policy and practice to change. Because that's really where we're trying to get to, is how do we address aging and aging issues, and how do we get people to think of it in a way that they want to embrace it? So let's go to the next slide. And I'm going to ask my colleague, Lori, to quickly go through some of the research.
Thank you, Trish. So our research is based on, the Reframing Aging Initiative is based on framing and we talked about the Frameworks Institute being our research partner. Well, let's go over some framing fundamentals. Next slide, Karan. So framing is about how we present information. Everybody frames because we all make communication choices, whether we are conscious of them or not. The choice can be verbal, like when we speak forcefully or quietly, or when we use our hands. In terms of communication with language, we know that words matter, and how we use those words is important for getting our message across. We make choices on what to emphasize, what to explain, and what to leave unsaid. Framing is actually a very powerful tool. As shown in our next slide, when a frame works, it shifts thinking in multiple ways. For the Reframing Aging Initiative, researchers expose study participants to different messages about aging. With the most effective frames, people's support for the kinds of statements you see on the slide went up compared to the control group. These frames increased people's knowledge that public policy can shape how successfully people age. They changed attitudes on whether we should increase funding for age-friendly policies. And they improved support for policies and programs that can benefit older people and family members. Next slide. So the research we conducted that was commissioned by the leaders of aging organizations for the Reframing Aging Initiative found a number of things. Essentially, the public has conflicting beliefs about older people. On one hand, the public believes that older people live a life of leisure in retirement, or they are frail and dependent. And ageism is not considered much of a problem. And even if age discrimination does exist, there are laws that deal with that. Research also identified cultural models. These are cognitive shortcuts that are in play when we talk about older people and the experience of aging. Knowing these cultural models allows us to strategize ways to communicate more effectively. Our job as reframers is to learn how to cue the right models. Next slide. As Trish said, studying the approach of experts in the field of aging was one of the steps in the Reframing Aging Initiative research. On the left side of the graphic, you can see how experts answer fundamental questions about aging and ageism. When the public was asked, as you can see on the right-hand side, well, there's a vast difference of opinion about aging and ageism. Part of what we do with the Reframing Aging Initiative is to bridge the gap between what experts know and what the public understands about aging. Next slide. We have already mentioned cultural models. These are those cognitive shortcuts or patterns of thinking that we all use to make sense of the stimuli that bombards our brains all the time. Our brains revert to these assumptions to help make sense of unfamiliar ideas. We use a metaphor called the swamp of public thinking about aging to help describe how we think, how our brains work. Swamps are rich, complex ecosystems filled with lots of flora and fauna. Just like our brains are rich cognitive ecosystems filled with assumptions and patterns of thinking. And just like the real swamp is filled with beautiful things like orchids and birds, and not so nice things like mosquitoes and alligators, these assumptions and pre-existing expectations can be fruitful, like the orchids, for your messages, or harmful for your messages, like alligators. Next slide. So here you see a map of this swamp of cultural models. As I said, we're using the swamp as a metaphor for our brains and how we think. Swamps are complex, and so is human thinking. Unfortunately, today we don't have a time to take a full tour of this swamp, but I just want to point out a couple of the challenges that we face in the swamp of public understanding. Knowing these patterns or challenges means that we can make changes to our communications to avoid some of these alligators. For example, The concept of individualism is deeply ingrained in the American psyche. We believe that how well we age has to do with the personal choices we've made regarding lifestyle and finances and health throughout our lives. The problem with this is that there's no acknowledgement of the environment in which we live. There's no context looking at the systems at work in our lives, which we know can have radical implications on our life's outcomes. Another example of the dominant pattern of thinking falls under solutions. You can see that we have here, it says fatalism and crisis. When we talk about aging as a crisis, such as a demographic cliff or a silver tsunami, we are implying that the problem is too big to be solved. After all, how do you deal with the tsunami? You can't. You just run as fast as you can the other way. Next slide. The good news is that not everything in the swamp is a challenge. We do have opportunities in public thinking. These are the orchids, the patterns of thinking that we want to activate in our communications. However, these patterns are recessive. That is, they're not dominant like the alligators are. With reframing aging, we promote the ideas that context matters, that we can work together on problems, and that in doing so, everyone benefits. And of course, we tap into the American idea that problems can be solved. Next slide. We talked earlier about the gap in understanding between experts and the public. Well, before non-experts can think like experts do about a social issue, they have to have their primary questions about the issue answered. And one effective way to do that is to tell a story that helps people organize information in a way that's easy to understand. We know that stories are effective ways to get information across. So a good narrative about a social issue doesn't just tell any story. It uses tested frame elements to build knowledge and understanding. The Reframing Aging Initiative uses evidence-based frame elements to boost public support for aging-related policies and programs. We use values to show what's at stake and provide big picture context. We use explanatory tools like metaphors to explain the mechanisms of the issue, how it works, and if it's not working, why not. And we always use a solution. We always provide a solution to show that problems can be addressed. And in this way, we tap into the cultural model that problems can be solved. Next slide. So, armed with the knowledge of the swamp and these tested frames, we can choose cues for our messages that activate the most helpful models and avoid activating the unproductive ones. Next slide. Now, the Reframing Aging Initiative, in the research, more than 12,000 members of the public were interviewed, the narratives were tested, and the values and the metaphors and solutions were tested as well. And they were formed into the narratives called Confronting Injustice and Embracing the Dynamic. And within these narratives, we use definitions of ageism, we explain what implicit bias is, and we talk about how aging is a process of building momentum, of gathering up the dynamism and insight and wisdom of our lifespan and using it to help solve the problems in our communities, our states, and our nation. Next slide. So I just want to quickly give you a sense of how we would summarize the recommendations of the Reframing Aging Initiative. I know we haven't gone through the details of the narrative, so some of these won't make complete sense to you, but we wanted to show you some of the communication cues to avoid and some to advance. So I would just remind you that framing is about choices, what to emphasize, what to explain, and what to leave unsaid. So for example, we know that fatalism is a challenge. So let's start explaining how problems can be solved by offering solutions. We know that individualism leads out the structural and environmental aspect of our lives. So let's emphasize that context and systems influence our outcomes. And we can counteract the decline in dependency stereotype by advancing the idea that the future is time for improvement. So unfortunately, this was just a quick overview. I hope it leaves you begging for more. But now I'm going to turn it back to Trish.
So if we go to the next slide, some places where you can beg for more. That as Lori, we have our research and our resources are on our website, reframingaging.org. We have a video series that you can watch that you can learn a little bit more about the research specifically and how to apply reframing aging tools. We have some documents that are prepared, some white papers that are prepared that also explain the research. And we can go to the next slide. We have a partner that we work with, the National Center on Elder Abuse. And if you have issues that you are addressing in your public health department around elder abuse, we would definitely recommend that you take a look at the work that they've developed on reframing elder abuse. Same issues. How do you cue the right models so that people are thinking about elder abuse in the way we want them to think about it, right? Let's go to the next slide. There is a movement around the country that I just wanted to share with you some of the work that's being done. So we have a national initiative where we are working with national policy, working with members of the administration, working with Congress, working with coalitions, right, to get us to reframe our messaging so that we can get the research funding in aging, get the programs and supports in aging nationally. But also we know that this can't be done at a solely national level. So we are working with different communities, and there are opportunities to work with you if you start to think about that. I mentioned the funders in the beginning of the program. These are the reciprocal, these are the programs that have moved forward. So there's work in Miami-Dade with the United Way. There's work in Vermont through their Disabilities, Aging, and Independent Living. There's work in Massachusetts, Colorado, New Hampshire, and each of these groups are working locally and regionally with different aging organizations, with different community-based organizations on getting people to understand how they can reframe aging. My very technical research term is that if we are working nationally and we have colleagues that are working locally, we are going to squish out ageism in the middle there. So if we can get people to start to reframe how they think about aging, we believe based on the research that we really can get people to support aging programs. So let's go to the next slide. If you start to say, well, what can I do? We'll share with you some resources, but one is a quick start practice guide. And so when you start to write things, I just want you to think about, we talked a little bit about that crisis language. Well, if you're starting with crisis language, how can you change that a little bit, right? We have a newsletter called Caravan where we cite examples of work that's being done around the country. We share different resources, and we also call out ageism where we see it so that you're aware of that. You can learn more about your own implicit bias. There's Harvard University has the Implicit Association test. So I've worked in aging for over 30 years, and I was a little surprised at my score. So you might be surprised to learn some things there. And we would say call out ageism when you hear it, right? So if your organization specifically wants a workshop or presentation, we're available to do that, and we'll be happy to work. We know that we're going to continue to work with Trust for America's Health on this project. So there will also be resources that will come through there as you're embarking on the age-friendly public health system project. If we go to the next slide. This is one thing that I want everybody to do right now, though, because after you leave this class or after you leave this workshop, just want you to think about it. I want everybody to pull out your calendar, whatever device you use to. I want you to go to February 21st at 2 p.m. and I want you to type one thing in there. I want you to say, "What have I done in the past month to reframe it, to practice reframe aging?" So just think about that. Am I reframing aging yet? Let's go to the next slide. changing culture is not an easy thing. It's challenging. We're trying to change attitudes and behaviors. But it's really important that we start now. And we see the Reframing Aging Initiative as one of those foundational pieces for the age-friendly ecosystem. Start to think about now how you can incorporate this, because we think that the positive perceptions of aging will be priceless. And as colleagues in Ohio, Age Friendly Ohio, have a button that says aging, it's so cool that everybody's doing it. So with that, I would say thank you. Ask you if you have some questions, if you want to chat some of those in. Megan, I'll turn it back to you.
Great. Thanks so much, Trish and Lori. I love that button. I wish we could get a whole bunch of them and just send them out. That's very cool. So while you all are thinking about your questions that you'd like to ask Trish and Lori, I have one for you. And as Jane said, I don't know, this could be a tough one, or maybe you've heard it before, but so I know I have to take that Harvard quiz because I'm sure I have some issues I need to deal with. But if we're trying to advance age-friendly public health and the age-friendly ecosystem, and we're up against someone in our organization, I don't want to say against, but there's someone in our organization
You are.
who may not be completely on board with that, and because they have this bias, well, we can't do anything about aging. We can't, there's already so many other, programs or whatever. How can we point out to someone else that they have the wrong attitude, or how can we address that, in the context of trying to advance an initiative?
So first, that's a great question, and it's a question that we hear we hear frequently. Only because I think reframing concept for us in aging is well, it's been there. It's relatively new when we start to really put it in front of people, right? So and how to actually apply some of the techniques that you can start to get people to think about aging differently. And so what I would suggest is, in particular with, in the age-friendly public health initiative, collectively, as you all start speaking from, you remember that slide that I had with the different cogs, right? So if you all start speaking from that same hymnal, and it takes a little bit of time. I mean, we do 3 to 5 hour workshops to really get people to understand how you can start to look at those challenges in the swamp and how you can start to tell that effective narrative, right? So it's one thing, everybody wants to hear a story, that's a great thing. But if you hear an individual story, you get an individual solution. And really what we're looking for is that when you see, we go to I don't know what slide it is, maybe like 31 or 32, Karan, if you can go to it. Oh, it might be like, but it's the effective social issue narrative. Stop, go for it. Go for it, go for it. Go for it a little bit more. Okay, stop right there. So when we start to tell that story and it has a concrete systemic solution, that's where you start to see people understand how they can make that change and see that that change is going to benefit us all. One of the things that we talk about is this benefits us all as we age, right? So it's not a zero-sum game that if you do something in school for schools, then you can't do something for aging. Like really getting people to think about that and how making sure that older people get their vaccinations, right? That's just as important as younger people getting their vaccinations. And we're not going to compare that. We're going to show how a vaccination program that looks across the aging continuum benefits us all, right? Grandparents are vaccinated, infants are safe. So there are ways that we can start to teach you, but I will tell you this, it takes practice and it takes consistency, and it's why we talk about it being a long-term social change initiative, because people aren't just going to believe you right away. So Lori, you want to?
Yeah, I just wanted to add something that Megan said at a workshop the other day. We talked about reframing is not about shaming or blaming, because in fact, we all have those implicit biases. I mean, we all have them, like Trish said. She even, somebody's been in aging for 50, 60, 70 years, even can have implicit bias. I know I didn't score as well as I thought I would. So when you're talking to people, like you were saying, in your organization or colleagues or peers, and they may act like, oh, it's not a big deal, you can say, well, actually, there's this thing called implicit bias, and we're actually all biased against our future selves. And when you talk about it in terms of how you have it too, you know, you put the other person, instead of acting like they're the one at fault, you can just say, we all have implicit bias, and this is a problem all of us have to address and face. So I think that's something that could be helpful. It's just, and we found from the research that when people know that this thing called implicit bias exists, it actually helps them to be more aware of it and less likely to act on it. So really getting to know your own implicit bias by taking the test and just understanding that we all have implicit bias, that could be a helpful discussion.
Great, thank you all so much. It's so helpful. What an interesting discussion. And just wanted to share, in case you didn't see it, my former colleague, Ann DeBiase, chatted in that people are so sensitive to racial equity and person-centered language now that when I point out the need for different language and framing around aging, they tend to be receptive. And I think that's I think that's true. I think we're starting to see this greater sensitivity analogies, you know, kind of across the board. So I think that's really helpful. A couple of people have asked whether the slides will be available. Yes, when we send out the link for the recorded training session, we will provide the slides as well. And let's see, Marcy, in one of your slides, the one titled Avoid in Advance, you want to avoid individual actions drives aging outcomes. How would you suggest communicating the recent brain research, such as what was in the Lancet about lifestyle choices and the impacts on brain health?
Well, I'm not familiar with that article, so I'll just give a brief answer and maybe Trish can add to it. But the idea is that we do make individual lifestyle choices, but we also don't do it in a vacuum, because where we live, whether we live in a neighborhood that has grocery stores that provides fresh fruits and vegetables, whether our education system is supportive so that we can get, you know, have a good education, whether we live in a neighborhood that has playgrounds and open spaces and nature that we can benefit from, those environmental contexts help shape and influence how we act as individuals. So it's a combination of individual lifestyle, but the lifestyle doesn't exist in a vacuum. It exists in a structure of the neighborhood, of the community, of the city in which you live, in the state. So that's what we're talking about. And again, Trish, maybe you know that research better than I do. Maybe you can help with that.
So I'm not familiar with that specific piece, but I will go make myself familiar with it now after the call. But I'd agree with what Lori said. And I think the other piece that we talk about are those social determinants of health, right? And how does that, so when we talk about, Karan, can you go back? Sorry, I keep making you go back slides. All right, let's go back to the slide that is the opportunities. That's it right there. So when you think about that, we want people to understand that what surrounds us shapes us, right? So that's where, we kind of went through these in the amount of time that we have, but if you were going to sit in a workshop, we would go through each one of these and what that means and what the research has showed us that drove us to why we recommend the values of confronting injustice and embracing the dynamic. Those tested the best when we worked with those 12,000 individuals, right? So really that's what you have to start to think about and that collective responsibility.
Excellent, thank you.
I also want to mention that Anne has been trained as a facilitator for us and works with us in quite a few projects on reframing aging. So it's great that she's here to participate today. So
absolutely. And I just want to also mention to our colleagues in Washington, Mississippi, New York, those of you we've been engaged with in age-friendly public health, if you want to reach out to Trish and Lori and potentially do a training in your state for your staff and your health department, I think we could probably work that out too.
Mm-hmm. Megan, can I ask a question?
Of course.
I know it's kind of turning the tables, but
Oh,
I mean,
great.
this is showing my ignorance. Because Anne in the chat mentioned sort of the approach that public health has. So tell me, like, what is the philosophy or approach of public health? Because I need to understand that so I can understand better how these work together.
You mean generally, what does public health do?
Well, I kind of know what it does. I mean, like the philosophical underpinning to it.
So I'm going to turn to my colleague Karan and put her on the spot, given that she has a degree in public health and I do not. So Karan, would you be willing to try and address that question, the philosophical approach of public health?
So Lori, that is asking a good question. I would say that the basis is education and prevention. Just you know, preventative measures, keeping people healthy through public health measures such as screenings and disease tracking. That's another big one. That's a lot of what the CDC focuses on, is monitoring and tracking diseases. And it's interesting because as we start to talk about the concept of healthy aging, I remember, and I'm going to introduce myself a little bit in this, looking for a job in kind of the intersection of, I know public health, but I also have an aging background. It's very interesting because when you approach some organizations, they're like, well, what diseases are you familiar with? And I'm like, I know aging. I understand the aging process. I understand what's going to help older adults stay healthier in the community. And their focus is on, well, we look at trends and we look at understanding tracking and things like that. So it's, there has been a history of focusing on tracking and tracing illnesses and conditions. And then you have the other side of it, which is this large, more tend to be heavier on maternal and child, global health. And I mean, their policy had a seat at the table as well, but for a large amount of time, aging was just kind of a more disease focused aspect of it. So healthy aging has finally emerged and come to the table saying, hey, wait a minute, we have this, you know, mindset of this model will help, for example, African Americans exercise more in the community, so they're not constantly having to get amputated, have their legs amputated because they're not managing their diabetes properly. So how can we help them? How can we intervene with older adults? And you have models like, I think of CDS&P, the Chronic Disease Management Program. That's a good medium of working with older adults, but helping them and encouraging health promotion and encouraging healthy behaviors. But so public health has had an interesting seat. And now that it's understanding, hey, aging is what we're doing from day one. As soon as we are born, we're aging. So that's my perspective on it. Again, I think that we've come a long way, because again, I remember sitting in grad school being the only person interested in older adults, and they're like, oh, so you want to go work in a nursing home? And I said, no, I want to help older adults live healthier
older
lives.
adults, they don't just live in nursing homes. Only 4% of the older population lives in a nursing home. The rest of us just live in houses in neighborhoods.
That's right.
Right.
And you know, and it's this idea, which I wish I also teach, and it's an interesting mindset to shift students' mindsets about aging. They have this mindset of, and I'm teaching a class about policy right now, and they think that it's like, oh, there's nursing homes. And I'm like, there's a lot more than nursing homes. There's a lot more opportunities in nursing homes. So yeah.
So that you've just named an area that is a really important area. And when we have, you know, more staff and more time, getting into the field of education for gerontology and geriatrics, and with even college students and younger, how important it is to have intergenerational programs and educational programs that include what aging means and what aging is like, so that young people don't just assume, like what you found when you were in college, oh, you're talking about nursing homes.
And even I think the other thing is understanding where aging intersects with a lot of different professions. So people that are in one area, they find themselves having to work with older adults. And especially, I think social work, for example, I interact with a lot of my friends that are social workers, and they know from day one, you're going to have some interaction, whether you want to or not, with the aging population. You may focus on children eventually, but you're going to have to be understanding of the whole lifespan perspective.
And I would throw in one more term, I think, Lori, when you think about public health, is upstream interventions versus downstream interventions. I think that that kind of helps to give you a visual of where public health sits in the care continuum.
That is exactly, yep, upstream approaches.
Well, and Jane did talk initially when she was talking about the age-friendly health systems, the collaboration between social services, public health, family systems, medical care. I mean, so my sense of public health is really that you actually do work with a lot of different systems and structures. Is that, so you would agree with that?
Yeah, yes.
Yeah.
Yeah,
Yeah.
absolutely.
If Megan, I just throw in a couple of comments. This has been so great, and the wonderful comments in the chat and the people that are attending and getting to know some of them. And so it's been so great. But I have been so wonderful for me to be able to work with TIFA and public health because I've learned so much. I knew about public health, of course. I'm a nurse, so I've worked with public health over the years. But what kind of, Karan, what you said is that in healthcare, we kind of focus on the individual and the family, you know, I mean, just as a unit. And my public health colleagues are teaching me that public health is bigger than that. So really, public health probably has more responsibility for our health than any place else. And because it really sets the stage for our health. I do want to also mention, Megan, if you'll let me, that about nursing homes, since you brought it up. We are also working, the John A. Hartford Foundation is working on reframing nursing home discussions, because that needs to be discussed, that needs to happen as well. And so the foundation recognizing how difficult and how important it is for us to help nursing homes with the terrible situation with the people dying from COVID in nursing homes. And I know in some of our previous calls, Megan, with health and aging, with HHS regions and other states, we know that it's a big issue in every state, and that the public health is drawn in that and part of that work. So we stepped right up and started nursing home huddles, and then our foundation president also has engaged the national academies to study nursing homes. Haven't been studied in 34 years, so that's being done, as well as a reframing nursing home. So I just wanted to throw that out there, that even though a lot of people don't live in nursing homes, that's true, just a small percent, but those that are, we need to think about as well. So just wanted to say a couple of things on that.
Absolutely. Thank you so much, Jane, for sharing that. And I think, you know, it's a bigger conversation. This is an ongoing conversation. I think that, you know, we will continue to have, and I think that Trish and Laura, I think we do want to dig deeper. And I think at some point, you know, we can do a follow-up training potentially, and maybe those on the call and others that we are engaged with, we can kind of pick their brains about what specifics, you know, where specifically they're looking for interventions, where specifically, you know, can we really help them to change that narrative within their work, and how can we really support that change process that you talked about at the very beginning.
Mm-hmm.
So if anybody's looking to just start today, when you go to write or speak about aging, remember that we want to think about, we want to avoid using those crisis pieces to get everybody's attention, right? Another way to do this is if you take a look at a paragraph that you just wrote, and you speak about older people as them, they, and you're othering older people as if we are not aging. Start to see how you can say we and us. They're the two quickest ways that you can start to start reframing aging, and people will start to model what you write and model what you say. You'd be surprised. So, you know, if you do nothing else, those are two things that you could take away from now. The third thing you might want to think about is your birthday cards. So I don't send birthday cards that are ageist anymore, and I've started asking people not to send me birthday cards that are ageist anymore. So.
Yes. Excellent tips to get us started. Ladies, thank you so much. Karan, if we can make sure and capture that chat so that we can have all those resources and the questions and the great suggestions that everyone has shared. And again, we will be posting the recording of this training session on our website. We will send that link out along with the slide deck to everyone who registered for the training. And for those of you in the states that we're working with, please feel free to share with your colleagues as well. And just a quick plug for our next training will be February, not the third Thursday, because there is an HHS regional workshop that day, but we will be having our next training on Wednesday, February 17th at 3 p.m. Eastern Time. And that training will be on health equity and addressing disparities in older adult health. So please join us for that one. You can find the registration on our website, which I did post in the chat earlier. So thank you so much again, Trish and Lori. We look forward to working with you continually, and really appreciate all of your thoughts and your great tips. Thank you, Jane, and the Johnny Hartford Foundation as well for your great support. Have a great afternoon, everyone.
Thanks for having us.
Thanks, everybody.
Bye-bye.
Thank you.